Okay, you guys, back with another video. I just made a video earlier about things I use to pass the NCLEX. Okay, now we're gonna talk about things I wish I would have known after I passed the NCLEX. New nurses out there, do not take the first job that hires you. Learn to negotiate. Learn to do your research. Because when you first get hired, you are going to be taken advantage of a lot. Before I passed the NCLEX, before I became an LPN, I wish I would have known about I wish I would have paid attention to how to adequately search for a job. Because when you first get out of nursing school, when you first pass the NCLEX, most majority of us have like dead bills, So, of course, you are probably going to run to the first job that, hires you. Not only that, the first job that hires you, but if it pays well at that. Okay. Now, making what I make now, I want to say making what I make now compared to what I made before, because I was a CNA for 12 years. Yes, I was a CNA for 12 years. Not too proud to say that, but hey, I started with the medical field at 19. Yeah, before I became a CNA. So I've been working in the medical field for a very long time. But like I stated before, I wish I would have known how to adequately search for a job. Okay? They kind of skim over that in nursing school, especially when you're going to school to become an LPN. That's another thing. I wish that I would have known what I know now. Maybe I would have just straight went into the RN program, but everything happens for a reason. That's just how I have to look at it. Another thing I wish I would have known. I wish I would have known, just like the whole, like, how different the atmosphere is, like how different it was, and things you need to know. Like I said, is how to search adequately for a job, how to negotiate your pay. Yeah, there is a thing called negotiating your pay, but employers would not tell you that. Yes, okay. You also need to know what shift you actually want to work. Don't take the first shift that's available. Please do not take the first shift that's available. Know that long-term facilities, the way they work, is different when it comes to hospital work. Okay? From what I have been told. Now, I work in long-term care, but I am slowly migrating to hospital care. I work in long-term care, but it's also still considered long-term acute care. Okay, um, it's a lot you need to know. Like, you need to know you need to know things as far as Forgive me, I'm having like a little I'm brainstorming right now. You need to know things about each shift. Each shift is way different. And considering the fact that I come from working as a CNA to an LPN, whereas those CNAs, it's not that much different, working 6 to 2, 2 to 10, 10 to 6. With a nurse, each shift has different things they have to do, okay? Like for as far as 2 to 10. 2 to 10 have to write orders. You have to put in orders. They have to do something called stiff notes if you're working at a long-term care facility. You have your 10 to 6. 10 to 6, they usually deal with the med pass at night. Now, don't think that just because it's 10 to 6, you will have an easy night. No, you need to know that you may have a large med pass if you're working in a long-term facility. I'm not really sure about hospital facilities, how their med pass goes. I think they use a Pyxis or something like that. But in a long-term care facility, it's a little bit, it's a little more brutal. But with that being said, you need to know what are the requirements and the descriptions and the responsibilities for each shift. Now, I'm not really clear on 62 what they have to do, but I do know that 2 to 10 tends to be kind of like the busiest because it's still in the evening going towards night. Not only that, like I said, they have a lot of documentation to put into like the system. They have a lot of documentation. And I think 62 has that as well, but not as much as 2 to 10. And like I said, 10 to 6 will also, you also have to document. So these are things that you should know. These are things that you should know. I really, I'm looking at the whole situation now and I'm just like, no, there's no way that I would anticipate on staying, just staying as an LPN for years to come. There will be elevation there. Yes, there will be elevation. But like I said, these are things that you need to know. Things that nobody told me, and I know they did not tell classmates of mine. But another thing is that what you need to know is you don't really get any real practice until you hit the floor and actually do it. Until you hit the floor and actually do it. These are things that you need to know as a nursing student, whether you're going to be an LPN or an RN. Now, LPNs tend to do a little bit more physical work. To me, an LPN is like between a CNA and a RN, and really that is like, that's where you stand at. Like, you stand between a CNA and an RN. And if you're gonna go for your LPNs, ladies, or LVN, ladies, understand that you are in that what do they call it, between heaven and hell, what do they call it? Like, it's between heaven and hell. I'm trying to think. Limbo. You're in the middle. You're in the middle. Okay? So you will take care of things that are dealing with as far as things that are assigned to CNAs sometimes, because you may be short. You, in this day and time, like with having corona, the facilities are stressed to the max when it comes to staffing. So that's something you need to know as well. You need to know that if you go into a long-term care facility, there's a chance that you could be the CNA and the nurse on the floor. Yes, there is a chance that could happen, especially if you work the night shift. Yes. Okay. There's a chance that that may happen. Sorry about that. I kicked the table on accident. But you need to know these things. That's something you need to know. What else I need to talk about? Oh, if you're an LPN and you just passed the NCLEX and you're looking at all of these LPNs and nurses and they traveling, they going with travel agencies, and they going and making all this money. And guess what? If you have just passed the NCLEX, have you a seat, honey, because you're going to be wherever you went and got a job, or wherever you went to, like, get hired, because guess what? You don't have enough experience to work in a agency atmosphere, because agency atmosphere, like what I've been told, travel and agency atmosphere is tough. They're going to give you the absolute worst always. They're going to give you they are going to give you what nobody else wants to work, because this is what they have called for. Okay, if you have just come out of nursing school, or just graduated, just passed the NCLEX, you are not, no agency will hire you if you have less than 3 to 6 months experience. Actually, they want you to have anywhere from 6 months to a year of experience. It used to be anywhere from a year to 2 years experience, but because Corona has turned everything upside down, like I said, they need workers, they need nurses. Okay, so just know, when you pass the NCLEX, do not even attempt to do agency nursing. Don't do it. They will not hire you because you do not have enough experience. Okay. Another thing, what I wish I would have known is find ways to get as much experience as possible. Find ways to get as much experience as possible, okay? Because you are going to be tested. You're going to be tested, whether it be job-wise, whether it be employee-wise, whether it be whatever. You are going to be tested, okay? So find time to get as much experience as possible. Do as much research as possible. Read up on more. Read up on more disease process as much as possible. That's why I got these index cards over here. I made a video earlier about things I use to pass the NCLEX, but I have not thrown away my materials. I have not thrown away my materials. That's why I said get as much experience as possible. Get as much experience as possible. Because if you do want to travel, if you do want to work in agency, then guess what? Your time is going to come. Just be patient. Your time is going to come. You need to be ready for that situation. You need to be ready for whatever is going to transpire. Now, you'll never be ready for everything, but at least you'll have some idea of how to at least find it, research it, get the job done, get it done. Okay. I'm trying to think, is this everything that you need? It's not everything that you need to know. These are just some things that you need to know, because these are some things that I encountered when I passed the NCLEX and I walked into the nursing field. These are some things that I have encountered, okay? And I know it's way more than it, and I'll keep making videos, keep coming back. I'll keep reiterating. But like I said, everything I said are things that I've experienced, and I was not told when I got out, and I had to find out for myself, okay? So with that being said, thank you guys for listening to this video. If you made it all the way through, if you were not bored, if your attention span didn't get, pushed somewhere else, just hit a like and leave me a comment in the comment box. I mean, leave me a comment, hit a like, leave me a comment, ask a question, anything. I mean, this whole YouTube journey thing, this is something that I've been wanting to do for a long time, but like I said, I stay in the wind, I stay busy, I stay moving, it's time. It's time. And I really like it. It's time. I really like this. I really like vlogging. I really like it. So, all right, y'all. Have a great day.